Welcome back to Neurodegeneration Awareness and Artificial Intelligence. I'm your host, Dr. Sukant Khurana. Today, we turn our attention to the dynamic and technological advanced region of East Asia, encompassing nations like Japan, Korea, Singapore, and China. We'll be exploring the current landscape of neurodegeneration awareness and the cutting edge role that artificial intelligence is beginning to play in addressing this growing health challenge. I'm delighted to welcome again Sohit, who's a researcher and a student and also an aspiring entrepreneur in AI domain. He traverses both AI and healthcare. Sohit, welcome to the show.
Yeah, thank you, Dr. Sukant. It's a really fascinating and rapidly evolving area.
Yeah, indeed, Sohit. East Asia presents unique context with its advanced technological infrastructure and diverse cultural landscapes. What are some of the key characteristics shaping neurodegeneration awareness in this region?
So there are several key factors are at play in countries like Japan and Korea with rapidly aging populations. There is a growing societal awareness of age-related conditions, including neurodegenerative diseases. But however, traditional cultural values around filial piety and family responsibility can sometimes influence how these conditions are perceived and managed within the household. In technologically advanced hubs like Singapore and parts of China, there is a greater openness to leveraging technology for health solutions, including AI. However, the pace of awareness may still lag behind technological advancements in some areas.
Very interesting interplay between aging populations and technological readiness. Could you elaborate on how cultural factors might influence the approach to neurodegeneration in East Asia?
Yeah, certainly. The strong emphasis on family care in many East Asian cultures means that the primary responsibility for caring for individuals with such conditions often falls on family members. While this provides crucial support, it might also lead to significant caregiver burden and potentially delay the seeking of formal medical help or even external support services. There might also be a reluctance to openly discuss cognitive decline due to social stigma or a desire to maintain family privacy.
Yeah, that's true. East Asia is at forefront of technological innovation. How is the existing technological infrastructure, particularly in AI, creating opportunities for enhancing neurodegeneration awareness and care?
Hmm. The advanced digital infrastructure in many East Asian countries provides a fertile ground for AI applications in healthcare. High mobile phone penetration, widespread internet access, and sophisticated data analytics capabilities are key enablers. AI can also be leveraged for developing highly accessible awareness campaigns through digital platforms, utilizing localized content and culturally relevant messaging. Furthermore, the region's strength in AI research and development is driving innovation in diagnostic tools and even assistive technologies.
That is very true. What specific AI powered tools or applications are currently being explored or implemented in East Asia to address neurodegeneration?
Hmm. We are seeing exciting developments in several areas. AI is being used to analyze medical imaging data such as MRI and PET scans for earlier and more accurate detection of subtle changes indicative of neurodegenerative diseases. NLP is also being applied to analyze clinical notes and patient-reported outcomes in local languages in order to identify patterns and even detect or predict disease progression. AI-powered virtual assistants and chatbots are being developed to provide information and support to patients and caregivers. And additionally, robotics and AI are being integrated into assistive technologies to aid independent living for longer.
Well, the potential for AI in early diagnosis seems particularly promising. How is AI being trained and validated using specific data characteristics of East Asian populations?
Hmm. So this is a critical area of focus. Researchers are working on building large, well-annotated data sets that include diverse East Asian genetic profiles, lifestyle factors, and linguistic nuances. Collaborations between hospitals, research institutions, and technology companies are essential for data sharing and model validation across different healthcare systems within the region. Addressing data privacy concerns and ensuring ethical AI development are paramount in this process.
Yeah, given the strong emphasis on family care, how can AI driven solutions be designed to effectively support caregivers in East Asia?
Yeah, AI can play a significant role in alleviating caregiver burden. And AI-powered remote monitoring systems can track vital signs and behavioral patterns, providing early alerts for potential issues. And virtual caregiver support platforms, leveraging AI chatbots, can offer information, emotional support, and practical advice in real time and in local languages. Robotics and AI integrated home assistants can also help with daily tasks, enhancing the quality of life for both the person with neurodegeneration and the caregiver as well.
Well, what are some of the most unique ethical and societal considerations that arise when deploying AI for neurodegeneration care in the East Asian context?
Yeah, several unique considerations are important. First of all, respect for privacy and autonomy is crucial, particularly given cultural norms around personal information. And ensuring equitable access to AI-powered solutions across different socio-economic groups and rural-urban divides is very much vital to avoid exasperating existing health disparities. Transparency and explainability of AI algorithms are also important for building trust among patients, families, and healthcare professionals who might be initially hesitant about adopting AI in such sensitive areas of care.
So, what role do governments and policymakers in East Asia need to play to foster innovation and the responsible adoption of AI in addressing neurodegenerative diseases?
Yeah, governments have a crucial role in setting strategic directions, investing in research and development, and establishing ethical and regulatory frameworks for AI in healthcare. Promoting data sharing and interoperability across healthcare systems while safeguarding data privacy is very much essential for fueling AI innovation and also supporting public awareness campaigns in order to destigmatize neurodegenerative conditions and highlight the potential benefits of AI-driven solutions is also vital. And coming to international collaborations and knowledge exchange can also accelerate the progress in this field.
Okay, so this has been truly enlightening discussion, highlighting the exciting intersection of advanced technology and cultural nuances in addressing neurodegeneration in East Asia. What's one key takeaway you would like our listeners to have?
Yeah, that East Asia, with its technological prowess and growing awareness of aging populations, is poised to be a leader in leveraging AI to enhance neurodegenerative awareness, improve early diagnosis, and provide innovative support for patients and caregivers. However, this progress must be guided by ethical principles and a deep understanding of the region's unique cultural and societal context in order to ensure equitable and impactful solutions. Yeah.
Well, a powerful and forward looking perspectives. Sohib, thank you so much for sharing your expertise with us today.
Yeah, thank you, Dr. Sukant. It was a pleasure.
And to our listeners across East Asia and around the globe, thank you for joining in Neurodegeneration Awareness and Artificial Intelligence. We hope today's discussion has illuminated the exciting potential of AI in shaping the future of neurodegeneration awareness and care in this dynamic region. Join us next time as we delve deeper into neurodegeneration awareness and AI for some other region of the world. Thank you and bye bye.